I am your host, Jason Hopcus, and honored to have my guest today, Dr. Shakari Hood, with us. Dr. Hood was raised in Richmond, Indiana, where she began her collegiate studies. She is an alumni of Ivy Tech Community College, Indiana University, and Indiana Wesleyan University. Dr. Hood obtained her master's degree in human resource management while in Indiana and relocated to Colorado in 2019 to finish her doctorate in business administration with a focus in healthcare administration. While in Colorado, Dr. Hood worked with a local federally qualified health center to complete her doctoral dissertation by assessing the organization's financial status and sustainability. She was able to identify diversified, targeted revenue streams that would not only aid in closing the uncompensated care gap, but provide culturally sensitive health services to the underserved populations while meeting the needs of each individual patient. Dr. Hood now resides in Aurora, Colorado with her husband, 3 children, and 2 dogs. Shakari has always had a passion for serving others with a commitment to making a difference in the communities of Colorado and surrounding areas. Dr. Hood combines her educational background, personal experience, and previous work in the nonprofit and healthcare industry to provide the underserved, marginalized, and minority communities with equitable outcomes through the deliverance of advocacy, resources, frameworks, and tools to overcome social determinants of health, racism, and bias. Dr. Hood, welcome. It's a pleasure to have you here today for Nobody's Perfect. How are you?
Good, good. Thank you for having me.
Well, it's a pleasure. So I was so inspired when we met a short while ago about the work that you're doing in your organization, specifically related to youth mental health in the BIPOC community, most importantly, and really thought this was a pivotal conversation for us to have because I think so often communities of color end up getting swept under the rug. And there are some specific sensitivities that I hope you will educate us on around the things that we need to know about the mental health challenges and struggles that youth today are facing in the communities that you're serving. And um, really just want to have a thoughtful conversation around that. So thank you for being here.
Absolutely.
So, jumping into this, give me a little bit of insight. Like you have a lot of education and experience that makes you qualified to be doing the incredible work you're doing. Give our listeners a little bit more insight to what was the point of discernment for you really recognizing, and there doesn't have to be one, there may in fact be many, but that made you realize that this was the direction that you wanted to go and really forge a career and a path in serving the communities that you do.
Absolutely. So back home, I grew up in a predominantly white area.
Okay.
And within the health organization and entity we have back home, probably about 93, maybe 94% of that community within the hospital and its employees are white.
Okay.
And I worked for a spine surgeon for about 5, going on 6 years. And I was brought into the human resource department at one time to go over my behaviors. So typically what you'll hear about with Black women in the Black community is that they are seen as aggressive and intimidating, which if you actually look at statistics and data, it means that a Black woman is just typically confident in who she is as an individual and what she's able to execute and bring to the table.
Love that.
And so when I entered into this conversation with our human resource director, who is white, she explicitly told me and said, Shakari, with your stature level, and I was just a medical assistant at that time, completing my master's in human resource management. She said, you are not at a level to be able to communicate with providers, specifically medical doctors or DOs. And what she was meaning is because I only was a medical assistant, that I didn't have enough education or knowledge to put me on the same playing field as being able to have those intellectual conversations that medical doctors and providers go to school to be able to discuss things in regards to the medical field, research data, statistics, things of that sort. And that was really the fire that was lit underneath me. It has guided me for the years to come. I grew up, raised by a single mom, and I was one of five.
Okay.
And so, coming out of college, or at least coming out of high school, I had my first daughter. And then I was the single mom for years after that and had two more additional children and continued to be a single mom. And so those factors in the statistics that are bundled around Black women and the success that they would have in their future being a single parent is what really fueled me to push forward and to begin to educate and showcase to other Black women that we are capable. Now, I'm not saying that my journey was easy, because by far it was not. It was a struggle. There was a lot of long nights, less sleep, things of that sort. But in the end, it was all worth it. And I was asked the question today, what do you choose to go by? Whether it's your first name, your nickname, what is the case? And I said, I choose to go by Dr. Shakari Hood, because that is what I work towards to achieve.
Right.
That is who I am. Those are the accomplishments and goals that I set forth. And that is what I did in order to showcase to my children that we can do anything that we set our mind to.
I love that. And I'm so inspired immediately. I got goosebumps as you were talking there, and really love the power in what could have been a very adversarial conversation and probably was uncomfortable in the moment
Yes,
from somebody who it sounds like really didn't see you,
yes.
that gave you such fruitful information that became the foundation that you built Dr. Shakari Hood from. Sorry. Um, I think that's so powerful and such an inspiration, not only to your children, but to others. So thank you for doing that work and being of service. You know, specifically around the education and training that you've gotten, I know you do a lot of work related to mental health in the BIPOC community. There's a couple of questions that come for that from our people that are listening. Maybe they're not as educated. What does BIPOC mean, first of all? And second of all, what are the mental health challenges that you are seeing in this community today that may be different than other populations are facing?
Absolutely. So BIPOC is Black, Indigenous people of color,
Right.
which sometimes it can be a conflicting term. It depends on the group of individuals and their perspective. And what I recommend is asking the group how they would like to be addressed. Some individuals love to be considered the BIPOC community, others prefer the Black African American community. And then you do have others who say, people or communities of color. And
Okay.
so it's always recommended in best practice that you ask individuals what they would like to be grouped as. And so this is something that drives the work that we see on an everyday basis, whether it's from me, from another individual, an entity, whatever the case might be, is understanding the true necessities of the communities that we serve. And specifically for me, it's serving the Black, minority, underserved, and marginalized populations.
Okay.
And the reason being is because I come from that background. I have the cultural experiences, I have the historical generational trauma, I have the present day trauma that is from a systemic or even an internal infrastructure piece that we see within the healthcare system, and all the data and statistics that surround Black individuals that have issues and disparities in relation to mental health diagnoses. And so I would like to provide you with some of the statistics that we currently see. And this is in regards to Black youth athletes. And so studies show that 50% of male and female athletes reported a sense of hopelessness during COVID-19. And this included Black athletes specifically facing economic hardships, and those living alone were the most affected. And then we see that 35% of athletes suffer from eating disorders, burnout, depression, and anxiety. And this is typically seen of elite athletes. And the depression or anxiety, while it's being faced and interfaced within the Black communities, only 10% of all college athletes with known mental health conditions seek care from a mental health provider.
Wow.
And then 70% of Black athletes with mental illness do not seek treatment. And so this means that they are either avoiding treatment, which often highlights the stigma in relation to the Black community. We do not see where mental health is something that is being focused on or talked about. And there's a lot of reasons that support this. And we have to go back all the way to generational trauma and the racism and bias and stereotypes that have been carried forward from tens to years of decades. We see that this conversation is not something that is typically found comfortable in the
Right.
Black community. And so oftentimes it is swept under the rug. Now, however, what studies do showcase now is that there is a discrete correlation between group-related sports activities and the support that child and adolescent mental health have in decreasing mental health difficulties. Specifically, research indicates that racial trauma exacerbates the impact of interpersonal trauma on Black individuals, specifically Black youth athletes. And so we have to take a look at some of these disparities, such as post-traumatic stress disorder, which is often seen in Black individuals due to the generational and ancestral traumas that have been carried down, all the way to anxiety, depression, the socioeconomic hardships, the SDOHs, which are the social determinants of health.
Okay.
All of this plays a part into the trauma that these athletes experience. And studies indicate that coexistence of mental and physical health conditions can be isolated and treated singular. And that's why I decided to create and develop the KIDS program, which is Kids in Therapeutic Sports,
Okay.
because we see that therapeutic exercise programs help protect against the onset of depression, prevents development of mental illnesses, and improves the quality of life and self-esteem. So it allows for individuals to be able to manage these anxiety disorders, being able to recognize them, draw attention, and seek the adequate health and care that is needed. And
Okay.
so ultimately, we are able to catalyze and sustain change. And that is the concept that I am moving forward as we enter into a new year and begin to address new issues and concerns that the Black community has identified as the necessary problems that exist today.
So if I'm hearing you, there are some distinct differences between communities of color and other less vulnerable or marginalized populations. And a lot of it is based on many of the things that you just shared: generational trauma, social determinants of health, etc. You know, are there more challenges that you see also? And I know you did this as part of your doctoral dissertation, that you see around the financial disparities that we often see in these communities that really contribute to poor or chronic challenges with mental health.
Absolutely. When we look at the social determinants of health in the Black community, we really, it depends on how you look at it. We're either at the bottom of the totem pole or we're at the top leading the statistics in a negative way. And so those social determinants of health are what allow us to be able to move forward or what impacts us the most. And so a lot of the times, communities say, well, if you do better, you'll feel better.
Right.
However, you have to take in consideration what is doing better, because when you have these barriers and gaps that are automatically applied to you just because you are Black, there has to be some type of way to connect resources into what you consider doing better and feeling better. And so when we look at finances, a lot of the times we look at underserved, marginalized communities and see that from a financial standpoint, that there is not a significant of money being funneled into those communities in regards to resources, in regards to foundation or grant money, or even state allocations. We see a lot of the times people categorize of, a lot of the times you'll hear being Black communities having ghettos, which ghetto is not a term that is or should be used today, but oftentimes in previous years, it's something that was brought up. And these ghettos are typically identified as lower class, HUD housing, Section 8 homes or apartments or condos, things of that sort, that are not necessarily up to date. You
Right.
see a lot of individuals in the Black community that have to rely upon state transportation, buses, things of that sort, or oftentimes you'll see individuals walking. And that's because the financial status of these underserved and marginalized communities are not efficient enough to be able to support the livelihood of that community.
Right.
And so when we take a look at those numbers and then apply it in regards to mental health and the resources that are needed to be able to address these disparities, we are decreasing the numbers. In Colorado in general, there is already a deficit in the number of mental health providers, whether that's nurse practitioners, psychiatrists, psychologists, licensed clinical therapists, whatever the case might be. And then when you narrow that down to individuals that have that lived and cultural experience, which is typically what the Black community wants, is to have an individual that has those same lived experiences in order to be able to treat these disparities and gaps. We are already dwindling those numbers.
Right.
And so when we look at the amount of mental health disparities that have been exacerbated post-COVID, and the amount of individuals specifically in the Black community that are in need of these resources, the demand is higher than the amount of individuals we have to be able to serve in these areas.
Well, even as you're talking here, I'm thinking, and thank you for so beautifully educating us on the challenges these communities face. I can't even put myself in their shoes in any form or fashion because I don't understand what it's like. I didn't grow up in that environment. I didn't have to take the bus or use public transportation, in some of those formative years, or really struggle to know where the next meal was coming from or can we keep a roof over our head. And I can only imagine the stress of just those factors, aside from anything else that's going on that you mentioned earlier, how it could weigh on and have such a negative effect on mental health. I love what you're doing with such intention around focusing on the mental health of youth athletes. Tell us more about that, because really what you're doing is trying to get at the very heart of recognizing these circumstances are real, they exist. We are likely not going to change those in a moment, but we can add or augment some support that makes a difference and an impact in perhaps the lives today and in the future of the ones that you're serving. Tell us more about this work that you're doing with your program.
Absolutely. So Kids was designed as an after-school program that focuses on catalyzing and sustaining change for Colorado's Black youth athletes. And what this consists of is incorporated mental health programming, group therapeutic services, and psychiatric oversight and assessment through sports-driven initiatives. And so, because studies show that the coexistence of mental health and physical health conditions cannot be isolated and treated singularly, it's important that a program was developed to be able to address both topics.
Okay.
So, I'm not sure if you're familiar with the triangular methodical theories. This means that when we look at a triangle and the three corners or the three angles balance each other. So if one weighs down significantly more than the others, it uplifts the two, but however also creates a gap. So what you have to do is try to find a way to stabilize and balance all angles together,
Okay.
which means you have to have all three present and one cannot be missing. And this is the same thing when we look at Black youth athletes in regards to their physical performance, their mental health performance, and then also their academic performance. All of these play and coincide with each other. Each one can create a detrimental impact if one of those angles is missing. And this program was created to be able to address those concerns. Now, when we look at Black athletes, there's already a disparity because, one, we know that mental health and the disparities and gaps that currently exist amongst the entire youth population has been exacerbated, and schools are not drawing enough attention or emphasizing this disparity. And when you throw a Black youth athlete into the mix, then once again, we're looking at how those social determinants of health, socioeconomic status, and things of that sort impact the individual at a greater degree.
Okay.
And so with the program, it is a 7-week course where myself and 2 licensed clinical social workers were able to meet with a set of, first, for the first pilot program, a group of 13 individuals who were all football players and identified as Black or BIPOC.
Okay.
And so we met with the individuals 2 times per week. For the first session, which was on Monday, we provided a 1-hour academic lesson in regards to the topic that was being taught that week. The second week consisted of an activity. Now, each time that we met during the week, there was a specific topic that was subjected to it. So week 1, psychoeducation and parenting. We discussed the barriers, beliefs about mental health, current experiences, and how youth might be experiencing or have experienced these issues, and how do we provide corrective information for them to better understand. We talked about introducing racial socialization as a protective factor, and then also provided ways that parents and caregivers can also have a play into how individuals and these athletes learn to understand the basics of mental health.
Right.
Week 2, relaxation. 3, effective expression modulation. Week 4, cognitive coping. Week 5, trauma narration and processing, and then so forth. And so each week we talk a topic to ensure wind it and mix this with the sports that they were participating in. So with it being football, each of these activities, each of these sessions surrounded football in regards to some of the gaps that exist, the racial and social behaviors, attitudes of coaches, and support that they may experience or not experience in regards to other players, their coaches, the school, things of that sort. And it was really eye-opening during the process because information from other coaches was expressed. There were comments that were made, and after assessment with the children and the participants, it showcased where some of these gaps and disparities truly exist and how the program has been able to benefit them in a positive direction.
Right.
Now, there is one scenario or comment that was made to me that completely blew my mind, that a coach who is able and to support these children and these adolescents perspective, but from an academic perspective and from an actual real life perspective, and grow these individuals into young adults who are able to navigate this world in the life that they will experience as a Black or BIPOC male. And the comment that was made to me was after a session, I walked out of the classroom and the students or participants went to go to their weightlifting. And one of the coaches approached me and said, "Now, Dr. Hood, you have and your group are going to go to prison." And it took a moment for me to collect my thoughts before reacting to this comment, because at this point, we were in week 5, and I have learned as much as I can about these students and participants into regards to, what makes them laugh, what, upsets them, how they interact with each other, what are their thought processes and things of that sort. And so I kind of seen them and took into account, what if this was my son who is 17 and this coach was talking and referring to him, an individual who has not even been able to realize or understand his life because he has had to deal with such traumatic experiences that has prevented him from even being able to succeed in the capacity that he needs in his life moving forward. And so my response to this coach was, no, I don't believe that, because each one of these students in this classroom is special in their own degree, within their own capacity, and have the capabilities to be able to do amazing things. However, what it's going to take is individuals like me having that compassion and that empathy and being able to support them to help reach their greater and their highest capacity. What it doesn't take is individuals like you who impact and create this hardship on these individuals who are just trying to learn how to live in this world.
Well,
It
and
was
such an
honestly, it
awfulized
was very
narrative.
disheartening.
Well, I mean,
Yes.
there's two things that came from what you just said to me, and I'm still just dumbfounded that you have this coach that is empowered with shaping the minds of youth through athletics, saying that most of these people are going to end, these men are young men are going to end up in prison. The power of that. Two things came up for me in recognizing that the call is coming from inside the house. One,
Yes.
and the second thing is you walked into these rooms with people while you're there to show up and do good and support them. It was not welcomed with open arms in the beginning. Is that
Yes, that is
and that was
absolutely
by
correct.
students and faculty.
Majority of it was by faculty coaches amongst the football team. That was not the first encounter I had experienced in regards to the program itself. There was also 2 other coaches who were not fond of these individuals having to pass up weightlifting in order to spend an hour 2 times a week with myself and the other individuals and facilitators of the program. Now, initially, yeah, the students were hesitant at first, but as we got more into the program by week 3, some things started to showcase itself. The students were becoming intrigued. They wanted to participate. They were asking, how do I overcome my fears? How do I overcome the trauma that I've experienced? How do I not become so aggressive and take my hatred and frustrations out on other people? They wanted answers, and they wanted to know how they could become a better person. And that's exactly what this program was created for. That's exactly what I was there to do. And it's exactly why I chose to spend every evening, those 2 days out of a week, to spend with them versus spending those moments with my family, because I am passionate about what I do. And the information that drives this is motivations for other individuals.
Well, and I can think, aside from you taking time away from your own family, you were being of service and giving back to kids that may not have that kind of support at home, that don't have a Dr. Shakari Hood at home that's giving them the feedback and the guidance that's going to help them navigate life differently. I think it's so easy for us to take for granted that everybody's life is like our own. Whatever
Yes.
your experience is, you assume everybody has a similar experience, good or bad. And I think from that kind of tone deaf, look, and it's not to criticize anybody's perspective, we don't realize that there are many people out there that never had a good example set for them, or never were able to express their feelings openly or in a thoughtful way that really had an eye on the future and what do I want out of life. And, even by your own admission, for you, it happened in one of your first jobs that
Yeah.
really inspired you becoming who you are. I can imagine how impactful and important and necessary this is to do this work. I know you've done this pilot version of it. Tell us what's next. Like what is your vision or dream of really being able to integrate this program into many, many other schools? What does that look like?
Short term, I would like to be able to work with several other schools to be able to implement this program. And the reason being is because I want to observe the additional data in the metrics that surround the program. When we take a look of, let's see, all females, what does that connection look like? What is the data at the end of the program? How does it present itself? Do we take a entire Hispanic or Latinx community and do the same thing? And then begin to insert all of these other different variables. We have the LGBTQ plus community. We have Asian Pacific community. We have all these other communities that we need to be able to assess.
Right.
And collectively, what I want to do is implement it across school systems because it's not just who do we address, it's how do we address them? What are the appropriate resources that we provide them in order to be able to have these enriched lifestyles and be able to address some of these disparities and gaps on their own? Now, some of the feedback that I received from the students was very thought provoking and really, pulled at the strings of my heart because one was like she kind of looked like an auntie to me, to where I could go to her with questions and be able to get that real base knowledge. Another individual was like, she reminded me of my mom. Another one said, I felt so comfortable that I could open up to her and be able to take her advice. I know that she's listening to me and I can listen to her. And
Mhm.
so it's building those relationships to get individuals and especially the youth activated and to feel empowered. And that's one thing that it took in my life, is having people who acknowledged my voice and also empowered me to move forward. Now, there was only a select few that were able to support me in that manner. And those individuals, I will for always be indebted to them because they were the ones who pushed me to do better and reach greater heights because they knew that I had the skills and abilities to achieve greatness. And that's what it takes. If I can help you reach your greatest capacity in whatever manner I can serve as, I know that I am being a servant leader and I am using what I was provided to be placed upon this earth for and elevating others to that level.
Well, I think that's so important and powerful, and that's resonant in how you show up in the world. I mean, you strike me as somebody who shows up like you command a presence, and we should listen. And I'm so grateful that you've given us some insight and educated us here today, not only around the work that we're doing, but really the miles we have to go and understanding the sensitivities of various communities that, frankly, you know, so many of us just don't have the understanding or the knowledge of yet. And I think where it starts is having inspired conversations like this around, here's what you need to know, and here are some things to consider. What I really love, most importantly, is, your focus on youth athletes. And, we look at athletics as being such a big part of the world, really. I mean, especially in the nation, and understanding the development of how our professional athletes start in these high school, junior high, and earlier settings, and really laying some foundational groundwork and giving them some tools and skills that they're going to carry forward in their lives. And to your point of, the people you had along the way that supported you, what I imagine you might say is that they saw you, and you're walking into these schools with that same gift to see these people. And to really give them words and a voice to things that maybe they've always struggled with or faced or didn't know how to talk about or address. And that's powerful. Thank you.
Absolutely. And there's resources out there. I've developed, ways that individuals, whether that is supporters, coaches, athletic directors, or school systems, can be able to support these individuals. But we also have to take a look at those other disparities and gaps and those variables that exist and understand that they are real life. Whether you are an elite athlete or whether you are just beginning your athletic career or whatever that may consist of, that all of this is real, that every bit of these mental health issues are able to creep up on you and you never even believe that it's there. Suicide is higher in athletes who have experienced an injury. That means we're going all the way to the elite status. We're not just looking at, it starts here when you enter into those preliminary stages of soccer and basketball and things. And then we move up the ladder as we go into school. And then if we get to a college and beyond that, all of this mental health is not subjected to just one group. It's like cancer. It can creep upon you at the quickest moment and in the most silent ways.
Right.
And if we teach individuals to be prepared and how to address this before it occurs, we are building the skill sets, the frameworks and tools to allow them to be able to transcend into a positive lifestyle with direction on how to cope.
Well, and above all else, also to recognize that when they're struggling, they are not alone and there are places of
Absolutely.
support and people they can reach out to. I think it's so powerful. Nobody's Perfect podcast was started as a precursor to Nobody's Perfect community. And we have worked diligently with our clinical team to
Right.
identify BIPOC resources, to have a hub of resources available. And of course, that list will continue to grow and expand as we move forward in the future. But I go back to, I think for anybody that's listening, if this is new information today, I truly believe as humans we can only meet people from our place of understanding or experience. So while this may be new information to you, it's also adding layers to your experience and understanding. And there is a value and importance for us continuing to have these conversations that highlight and add insight and depth to how we show up in the world, and recognizing that how we live our life may not be how everybody else does. And I think
Absolutely.
that's really important.
Yeah, absolutely. And, I make myself available, from an individual, from, an educational perspective, from, a business perspective. I am here to help. That is my passion, to motivate, to lead, to get others to understand how to reach their highest potential. And what it's going to take is community members, facilitators, entities, organization, groups to understand to use these people who are here to do these great things and encompass them in the work that they're doing to
Right.
be able to create these waves.
Well, and I'm glad that you're leading that charge. Thank you so much for educating us on this today. We always like to ask our guests one question before we wrap up. What does nobody's perfect mean to you?
For me, I look at it from a personal perspective, is that I've been through some terrible things in my life, but that does not define me. And it's not what carries me forward to today. I create the definition surrounding who I am as Dr. Shakari Hood, and I will not allow anybody else to determine that for me. Not a statistic, not a data analysis, nothing. So, who I am and what I create and allow myself to be is explaining that I'm not perfect, but I'm willing to help myself get to the place that I need to be.
I love that. I mean, just to reiterate, you are standing on a solid foundation that you built. Kudos
Yes,
to you. Thank you for being here today.
absolutely. I
It's such a
appreciate it.
pleasure. And thank
Yeah.
you for being a part of Nobody's Perfect community dedicated to supporting, inspiring, and empowering youth and families. We hope you enjoyed today's transformative conversation with Dr. Shakari Hood, and together we're dismantling stigma and providing solutions for mental health and well-being challenges so everyone can thrive. Join us every other week on cozy101.com/imperfect or your favorite streaming platform to continue embracing our shared human experience. If you or someone you know is struggling with mental health, visit nobodysperfect.community to get immediately connected to a hub of clinically approved resources and tools designed to support you wherever you find yourself on your journey. And be sure to follow us at Nobody's Perfect Community on Facebook, Instagram, YouTube, and TikTok. I am your host, Jason Hopcus. It's been a pleasure having you here. Stay connected, stay inspired, and remember, nobody's perfect because perfection isn't real. Your story is. Until next time.